Hello and welcome back. Once again, I am your tutor, Ashok Rajguru. In the previous video, we saw the analysis of the case which was presented by Dr. Harvey Farrington in Nash's book. The remedy that we arrived was exactly the same remedy which was prescribed by Dr. Harvey Farrington. And it is indeed remarkable that such a painful and a chronic condition for which allopathy has absolutely no medication could be treated and cured by homeopathy. In this video, we shall be taking a look at some other remedies. So the objectives of this session are to review other remedies in homeopathic materia medica that have been used in cases of trigeminal neuralgia. Meserium was the remedy that was prescribed in the case, as we saw in the analysis video. Important to note that in Boscher's book as well, it has been mentioned that it is helpful in head pain on the left side, where the pain is into the eyes and the malar bones into neck, etc., with lacrimation, that means with tears. You'll remember that even in this case, the patient had mentioned that he would have tears dropping out of his eyes. It is also mentioned by Boscher that it works for facial neuralgias and toothache that extends into the temples. So that comes a very close description to the particular patient that we saw in this case. Facial neuralgia or toothache, when the pains are greatly worse by eating or motions of the jaw and better by radiation of heat. So this is by Nash, and that also matched with the case taking quite fairly. Phatak, another very useful materia medica, mentions that neuralgic pains come and go quickly. Meserium has also been used effectively by herbologists, and here are some references which can prove useful. It's a hardy shrub which is a native of Great Britain and the northern countries. And mother tincture is prepared from the fresh bark before the flowers appear. The roots are chewed in toothache. So there is an association with teeth and with the nerves in that area. In Germany, the tincture of berries is applied locally or topically in case of neuralgia, that means nerve pain. In Siberia, it has been effectively used for snake bites and for other venomous bites. And the veterinarians have been using it for horse hooves. I'm not sure if that means the pain when the horse's shoes are nailed in. I'm not very sure of that, but I would guess that since it has an association and affinity for the nerves, that could be the case. Now we'll have a look at some other remedies. These are small remedies and they do not appear in the materia medica or the repertories, but they do appear in homeopathic journals where they have been reported in the past. This is a repertory by Kner and Calvin Kner. He was an American homeopath, and he has written a repertory based on the guiding symptoms of herring. And the remedy that is mentioned is colchicum, which figures as a single remedy in 3 rubrics related to right-sided neuralgia. If you recall, this particular case had a left-sidedness. It is a right-sided neuralgia affecting the eyes, ears, and the neck. So just to give you a fair idea of this remedy, this is what it looks like. It's a beautiful plant that grows in the meadows. Now, going further into that repertory which I mentioned, this graphic shows the 3 main regions of the face which are affected or which are served by the trigeminal nerve. And now if we look at the 3 rubrics, eyes, neuralgia, right, in tic douloureux, which is trigeminal neuralgia. So it's quite specific to the disease or disorder. Ears, as you can see, it may be the margins of the ears in front because that is the area served by this nerve, and neck neuralgia right side in tic douloureux. So it's quite specific for this disease. That could prove useful, good information to have, or you can always access this information on this particular website. Another remedy which has proven of use is Cicale cornutum. This is actually the fungus. It's actually the fungus that grows on the on rye. As you can see in the picture, you can see those little black things. So it belongs to the fungi kingdom. And this has been reported way back in 1872-73, the Hahnemannian Monthly, which was a professional journal in those days. And this is a case of one E.B., 21 years old, who had this problem of a severe tic of the left side of the face. And it was also affecting the inferior dental nerve. In our case, it was on the upper canine tooth and extending downwards. In the case that we saw, the pain was extending upwards. So a good thing to know, these small differences can make a big difference in determining the remedy. Another case reported by the same doctor in the same journal is that of a man, 35-year-old, who had neuralgia known as a brow ague. So ague is an old term, now archaic, for pain. So a brow, once again, that is the area that is served by the trigeminal nerve. And it was cured by ergot infusion. So it was cured by the infusion of this particular fungus, not in the potentized form. So that's more of a herbal application, but homeopathic in nature apparently. Another very interesting case, this was a case where the doctor was able to cure trigeminal neuralgia on the basis of using Nat Muir as a constitutional remedy. So that once again underlines that addressing the disease name alone will not solve the problem sometimes. And this was reported way back in 1927, 90 years ago, in the Quinquennial Homeopathic International Congress. So it was in a conference that it was read out as a paper. And the homeopath says that a few cases of tic douloureux that I have met with all yielded to Nat Muir. One case which he quotes is that of a woman who had this problem for 7 years, and there was another one of 3 years after she had undergone one surgical operation and was advised to have another just before she came to me. So that's another marvelous cure. To be noted, it's not the remedy name that matters. What matters is that it was the constitutional approach. In other words, it was taking into consideration the whole case and the patient into view. Now here is another interesting remedy, which is natrium cacodyllicum. The chemical name in modern chemistry, sodium cacodylate. And this has been known to homeopaths for quite some time because it appears in Boricae and it has got references in Clark. But it has become quite infamous because it's a very toxic substance and it was used in the Vietnam War by the American Air Force and Army. It was called Agent Blue. Some of you might remember another agent which was Agent Orange. They are termed as pesticides, but they really destroy the crops. That's why I said that this is a very infamous substance. And apparently almost 20 million gallons were sprayed over that small country of Vietnam to destroy 500,000 acres or 2,000 square kilometer area of crops. Homeopathically speaking, this has served mankind much better, and it has been used for the ailment that we have talked about. If you look at Boricae's repertory, you will find 5 rubrics, where it has proved effective in tuberculosis, in epithelomia, and in cancer of the breast and cancer of the uterus, and for tumors in general. If we look at the rubrics in the complete repertory 2014 edition, and we restrict our rubric size to 200 or 250, then we see that it has quite a close affinity for nerves. So you have paralysis of the left extremities, lower limbs, and in the generalities, it has inflammation of the nerves, neuritis, paralysis on the left side, and one-sided hemiplegia, which is quite close to the description that we come in the case that was discussed in this module. So another remedy that could prove useful, just to tuck it away into your memory. The message is you can't remember all these names. You may not be able to extract it, but remember, these are available in resources which are normally part of homeopathic software, which has got many journals added to its library. So I'll just summarize the points that we have seen in this video. We looked at the references of Merserium by different authors in their Materia Medica and how they have proved useful. Then we saw a few other remedies, colchicum, cicale, natmur, and sodium cacodylate or natrium cacodylicum. So these are a few of the remedies that have proved useful. And it always helps if you can do a search on the homeopathic software and read the old journals. They may not come up in your repertorial analysis or in many Materia Medica. So once again, thank you very much for your attention, and I hope you found something useful. Please post your comments and participate in the activities and discussions going on in the forum. I'll be most happy to answer your questions if you have any, or it could be some other participants who will also provide you with a lot of knowledge and information. So thank you and bye-bye.